So, hello friends, I am Dr. Anshul Bansal, again joining on Unacademy platform. As you all know, I am here to guide you through your preparations for NEET PG for the subject of orthopedics. Here we'll study orthopedics and we'll study about in-depth knowledge of orthopedics so that you can not only crack your NEET PG, INICT, FMG competitive exams, but it will also be useful for your prof examinations. We'll give special focus and emphasis on your clinical based questions and x-rays and images, keeping in mind the coming next pattern as well as the recent NEET pattern. Okay. I am currently working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cleared the same NEET PG examination last year, that is in 2020 only. Okay, so in today's lecture, we'll study about fracture management, okay, and how to manage a fracture in a casualty ward as soon as the patient comes to you. Okay, this is a basic thing which every MBBS doctor should know. Okay, if you have any doubt during your lecture, you can type that in the live chat box and I'll try to solve it. Okay, so let's start the session. And before starting the session, I would like to give you a brief description about a paid subscription plans for NEET PG available at Unacademy platform. Okay, firstly, we have Plus subscription. In Plus subscription, you will get daily live classes and daily live tests and quizzes. Okay, plus you will get structured courses, and our courses are structured in a strategic and simplified manner so that you can build your concepts about subject and topic first, then read it about the theory and its in-depth knowledge, and you can correlate it with the other subjects also. Okay, and also you will get unlimited access anywhere anytime to our QBank live as well as a recorded videos. The second is the iconic subscription. The iconic subscribers will get the prep ladder absolutely free, all of its Q banks and video lectures and rapid revision courses, as well as the other things that I mentioned earlier on an academy. You will get extra live batch wise courses by esteemed faculty, plus you will get the hand made hard written notes of our lectures, as well as you will get daily live tests and quizzes, GTs and all, and you will get a personal assessment of every test so that you can find out where you are lagging behind and you can prepare accordingly. So for both these subscriptions you can use this promo code, and by using this promo code you will get extra 10% off. As you all know, NEET PG 21 is scheduled next month only, so hardly 40 days left. So we have started a rapid revision courses for the NEET PG 21, as well as for the same exam we have started a clinically integrated batch. Okay, so you can avail the offer and you can go for the subscription and you can use this code. Okay, now keeping in mind the next pattern exam, as well as for our MBBS students who are going through their prof university examinations, we have started a 3-year batch program. Okay, the duration for which is for 3 months. Okay, so you can also enroll for it and you can use this code to get extra 10% off. Okay, now keeping in mind the FMG students to clear their entrance MCI examinations, we have started a focused batch on for them also. Okay, and you can similarly use this code to get extra 10% off. You can use this code not only for NEET PG subscriptions but also for NEET UG or UPSC or other board examinations also. You can use this code for any subscription plan on Unacademy to get extra 10% off. Okay, now we are running a limited time period offer in which if you will buy any subscription plan of 12 months, you will get extra 2 months of it absolutely free, and extra 10% off if you will use this code. Okay, and I would like to suggest to buy a subscription plan with a longer duration, because there are two reasons. Firstly, as you can see, the per month cost of the plan decreases significantly on increasing the duration, and secondly, keeping in mind the next pattern, you need to be more vigilant about your studies, and you need to maintain a clinical knowledge of every subject, which is possible only if you study from the starting of your MBBS. Okay, so please go for the subscription with longer duration. Okay, and we are regularly taking special classes on Unacademy app. So for special classes, you need to do two things. First of all, download Unacademy app, which is absolutely free, and also you need to subscribe on the Unacademy, which is also absolutely free. And in these classes, you'll get a live classroom like feel, where you can interact with your educators, raise your hand to ask your doubts, participate in the polls, you can interact, and you can clear your doubts there and there only. Okay, and you will never miss a class because you'll get regular notification. And a very beautiful thing about is this: you can hear the lecture or take the lecture anywhere, anytime. You need to just open the mobile application. Plus, you'll also get the lecture notes. You can download the lecture notes what we are reciting in the lecture. Okay, and we are also running a special bugs bounty program, in which if you find any inappropriate content in a video of any educator, you can contact a team. The link is given below, and if it is found correct, you can win handsome offers and prizes. Okay, so let's start today's lecture about management of fracture. Okay, so treatment of fracture can be considered in three phases. First, the emergency treatment, which is done at the casualty ward or at the site of the trauma, and it can be done by a doctor or any non-medical person also. So this part is that part जो हर इंसान को पता होना चाहिए. It is a very basic thing. Then we'll go for the definitive care, which is done by a doctor, trained orthopedician, and the very important thing is rehabilitation. Okay, the किसी भी फ्रैक्चर का ऑपरेशन कराना या कास्ट लगाना, it's only a part of the treatment done. Okay, the rehabilitation and physiotherapy is very important. Okay, so first we'll study about the emergency care. So okay, so emergency care, as I've told you, begins at the site of the accident, and it consists of four things, and you can understand with a mnemonic RICE. Okay, R for rest. फर्स्ट ऑफ ऑल, कोई भी ऑर्थोपेडिक इंजरी दिखी है आपको, बोन फ्रैक्चर होगा, एंड इफ इट इज वेरी डिस्प्लेस्ड यू कैन सी द डिफॉर्मिटी. फर्स्ट ऑफ ऑल, रेस्ट द पार्ट बाय प्रॉपर स्प्लिंटिंग. अब व्हाट इज स्प्लिंटिंग? सी, इफ यहाँ पे फ्रैक्चर हुआ है एंड देयर इज डिफॉर्मिटी हियर, सो यू कैन जस्ट पुट अ मैगजीन और कार्डबोर्ड लाइक थिंग हियर एंड रोल इट ओवर विथ एनी बैंडेज और a thread, so that this part is stabilized and this part is at rest. ये हिलेगी नहीं. Okay, this is called splinting. The next, I stands for the ice therapy, which helps in reducing the inflammation and the swelling. Okay, and C for compression. You need to compress it by if it is closed, you can compress by crepe bandage. Okay, जिसको हिंदी लैंग्वेज में गरम पट्टी भी बोलते हैं. ओके, और यू कैन पुट अ cotton roll and then put gauze or bandage over it, roll over it. Okay, and E for elevation. It is very important कि कहीं पे भी आपके फ्रैक्चर हुआ है, just elevate that part. Okay, it helps in reducing the swelling. It is very important. Agar if it is of upper limb, you can elevate the hand by this, by tying it to a sling, or if it is of the lower limb, you can put pillow beneath the legs to elevate the leg. Okay, so the most important and the primary thing you need to do is the splinting, and splint the limb where they lie. Okay, कुछ भी नहीं समझ आ रहा है. Okay, so just give a small traction and put a cardboard or magazine or any hard thing that you get, and just tie it on the posterior aspect of the limb, and make it immobilize and make the limb rest. It is the foremost thing that you should do. Okay, but before applying the splint, you should remove all the ornaments अगर patient ने पहन रखे हैं. And what all things you can use? You can use a folded newspaper, a magazine, a cardboard, a stick, umbrella, pillow, wooden plank, etc. Anything that you can get. And like if it is of the upper limb, okay, so after splinting you cannot leave the limb like this, है ना, ऐसे नहीं छोड़ सकते. You have to keep the limb elevated. So for this, कोई भी a piece of cloth or bandage that you get, make a sling out of it, है ना, make a sling out of it. I'll teach you how to make a sling, and just elevate the limb by tying it over the hand. Okay, so any available long piece of cloth can be used for tying the splint to the fractured limb. Okay, and the most important thing for any orthopedician or for any doctor who is assessing the orthopedic injury in a casualty is to check for the vessel and nerves in the distal part of the fractured segment. Nerves can be tested by active or passive tests of the muscles which is supplied by the concerned nerve. Okay, like humerus में radial nerve अगर injured है तो you will get wrist drop. अगर peroneal nerve injured है leg में तो you will get the foot drop. And for vessel you have to palpate the peripheral pulse. Like in the upper limb we palpate radial artery or ulnar artery, and in the lower limb we palpate the PTA and DPA, posterior tibial artery, and the dorsalis pedis artery. Okay, so it is very, very important. Now, what are the advantages of splinting? There are many advantages of splinting. The most important advantage is its relief of the pain by preventing the movement at the fracture, and you have almost, it is a method of immobilizing, and आपने immobilize कर लिया है, so the displaced fracture segments or the undisplaced fracture segments will not get displaced, and the displaced fracture segments और ज़्यादा displaced नहीं हो पाएंगे. Okay, and by preventing the displacement you are also protecting the soft tissues, skin, vessels and nerves of that part, because if it is not immobilized by a splint, okay, the fracture segment are sharp edges, so they'll hover around like this, and by this motion they can injure the soft tissues, make a closed fracture compound, as well as they can injure very important nerves and vessels also. Okay, now the immobilization also prevents grave complications like fat embolism and hypovolemic shock, and also it makes the transportation of the patient easier. Okay, now this is an example of the splint made out of the cardboard. It is type of a fancy one, but any layman can also splint by इसको इतना fancy नहीं बना के just put a cardboard on this aspect, है ना, and just roll a bandage over it or cover it. Okay, this will also do. Okay, now rice में we have done rest. Now I for ice therapy. Ice therapy is also a immediate thing that you should do, and it helps to reduce the swelling as well as the pain, है ना. And ice therapy कैसे भी कर सकते हो, just put ice in a plastic or polythene bag or any cloth and apply at the injury site. Okay. And if there is wound or compound thing, है ना, so ice सीधे नहीं लगानी, just put a sterile cloth if possible over that and then do the ice therapy. Now C for compression. As I've told you, compression is important to reduce the swelling, and also compression is important in open cases. If there is a open injury or wound, it will help to reduce the bleeding also. So it can be done by a crepe bandage or a simple bandage also, or by applying the local pressure also if there is a bleeder. And elevation, as I have already told you, elevation is very important to reduce the swelling, and the elevated limb or the injured limb should be above the level of the heart of the patient. For lower limb, it is done by using the pillows, and for upper limb by sling. Okay. Now, in the emergencies department, as soon as any patient of trauma arises, first of all, you have to check for any head injury or chest injury or abdominal injuries. Then if there is some fracture, you have to do this rice wali thing, and first and foremost you have to assess the vessels and nerves. जनरली ऑर्थोपेडिक इंजरी से कभी भी इंस्टेंट डेथ या इमरजेंसी डिपार्टमेंट के अंदर ही डेथ नहीं होती है. इट इज़ वेरी रेयर, बट इफ इट इज़ वेरी कंपाउंड एंड वेरी ब्लीडिंग एंड ऑल, so it can occur. But majority of a deaths of a trauma occur due to head injury or abdominal injury or chest injury. ओके. सो कोई भी पेशेंट आपके आता है तो इट विल मोस्टली इट इज नॉट ऑफ अलोन ऑफ एन ऑर्थोपेडिक इंजरी. ओके. कोई भी एक्सीडेंट हुआ, आरटीए हुआ, असॉल्ट हुआ और फॉल फ्रॉम अ हाइट का केस हुआ, सो देयर विल बी अदर एसोसिएटेड इंजरीज आल्सो लाइक हेड इंजरी और abdominal trauma or chest injury or injury to the eye, etc. So first of all, you have to provide the basic life support, BLS, the oxygenation. Okay. Proper, you have to monitor its vitals and all. And if it is in shock, you have to first stabilize the patient by giving IV fluids or intubate the patient if it is necessary. Okay. Then you have to shift the patient after stabilizing it for x-rays and other investigations. Okay. Now, as I have told you, particular attention is paid to head injury, chest injury and abdominal injury. And if any bleeder or bleeding is recognized, put a local pressure and try to control it. अगर उससे भी कंट्रोल नहीं हो रही है, just give a suture there, infuse tranexamic acid to reduce the bleeding. For reducing the bleeding, a small bleeder, you can use ice also, and or proper bandaging and compression is applied. Okay. As I've told you again and again, nerves and vessels को check करना बहुत important है. Okay. And if a patient has come after bandaging any elsewhere और कहीं और से dressing करा के आया है, तो a good orthopedician always removes that slab or cast or bandage, first of all to assess the vessels and nerves, and secondly to assess if there is any wound at the site of the injury. Okay. And obviously आया है, there will be pain, so you have to give analgesics, pain relievers, either IV or IM. Okay. And if it is head injury, we all know in head injury patients, narcotic analgesics like morphine and all should be avoided. And if it is an open wound, you have to start the broad spectrum antibiotics, okay, like ceftriaxones and other cephalosporins, etc. Okay. And when the patient is stable, then the patient should be sent for further investigations. Now, the second phase, in second phase, we'll go for the definitive care of a fracture or any orthopedic injury. So, over the years, the trend and pattern of the definitive care of orthopedics is changing. Earlier, the majority of the cases were treated by immobilizing by cast or slab or traction. Okay, excuse me. Okay, but nowadays the pattern is changing by more shifting towards the operative side. And why it is happening? Because पहले एक तो इतने recent advances नहीं थे, plus the पहले the priority was to align the bone and then wait for the callus formation and so that bone heal हो जाए. Just ये objective था. But इससे क्या होता था, लॉन्ग टाइम कास्ट एंड स्लैब एंड इमोबिलाइजेशन की वजह से फुल रेंज ऑफ मोशन नहीं आ पाता था जॉइंट्स पर, बिकॉज there used to be stiffness of the joints and atrophy of the muscles, and early mobilization of the patient was not possible. But with the increasing trends towards the surgery say what you do, you fix the fractured part, so early mobilization of the patient as well as the associated joints is possible. So muscle की wasting and joint stiffness and all के chances बहुत कम हो जाते हैं. So जो मैंने अभी समझाया that is only written, बस थोड़ा अंग्रेजी में लिखा हुआ है. Okay, so in the past the aim of treatment was a mere fracture union. It could be achieved in most cases by immobilization, but it would result in joint stiffness and muscle wasting and may result in less than optimal functional recovery. Okay, but now the major aim is to get limb functions back to the pre-injury level, and for this we need early mobilization. Okay, and for early mobilization we need a perfect and a rigid fixation of the bone, which is done by the operation or surgery, and it is particularly very important for the intra-articular fractures, because if intra-articular fractures are not reduced properly, they'll make the joint stiff, lead to the arthritis of that joint. Okay, and in the diphyseal fractures, good alignment and maintaining the length of the limb there is sufficient, and it will unite. Okay, the bone will unite. Now, the fundamental principles of fracture treatment includes three things. First is reduction, second is immobilization, and third is preservation of functions. Preservation of functions is done when the bone is sticky and beginning to join, then you go for the physiotherapy. Immobilization, we have डिस्कस्ड ऑलरेडी कि क्या इसके बेनिफिट्स हैं, क्यों करना चाहिए एंड कैसे करना चाहिए बाय स्लैब्स कास्ट. विल डिस्कस इट लेटर. एंड फर्स्टली यू हैव टू डू द रिडक्शन. नाउ व्हाट इज रिडक्शन? सी if this see if this is a bone and it is fractured. Okay, now if it is fractured, so if it is fractured and the part is displaced like this, so union हो जाएगा, but there will be shortening of the limb as well as there will be malunion and deformity, and it will hamper the functions of the joint and the patient lifelong. So first you have to align the fractured segment so that कि वो पहले जैसे ही normal anatomical position में union हो. So for that you have to reduce the patient. So bringing back the fractured segment in the normal anatomical position is called the reduction. So यहाँ से यहाँ पे लेके आना is called the reduction. Now reduction can be done by two types. Okay, firstly you can do the open reduction and secondly you can go for the closed reduction. So first of all you try the closed reduction. Closed reduction is without opening the fracture site. यानी you will not give any incision, you will not uh, open the fracture site, you will just give traction and apply various maneuvers and proper manipulation, and then you'll closely reduce the fracture site and then immobilize it or fix it by non-operative procedures like slab or cast, or by operative procedures like percutaneous K wires. Okay, so this is closed reduction. Now for open reduction क्या करना पड़ेगा, आपको ओपन करना पड़ेगा, मसल स्प्लिट करनी पड़ेगी, reach the fracture site, then reduce it by the instrumentation, and then fix the reduced site by plating or nailing or other types of implants. Okay, so this is about reduction. Okay, so we have discussed what is reduction. It is a technique of setting a displaced fracture to proper alignment. Okay, if it is not operative, it is called closed, and if it is operative, it is called as open reduction. Okay, and after reducing it, immobilization is necessary to maintain the bones in the reduced position. Okay, it can be done by external immobilization like putting plaster or slab or cast, है ना, or by internal fixation as we have discussed earlier by rods, plates, screws, etc. Okay, but it is only half the job done. ठीक है, to get the proper functioning of the limb and the entire range of the motion, you have to go for physiotherapy all throughout the treatment, even if the patient is in slab or cast. Okay, that is very, very important. See, here you can see it is externally fixation by a slab. Okay, and cast. Now what is difference between slab and cast? कोई भी पेशेंट आता है फ्रैक्चर का, आफ्टर रिड्यूसिंग इट फॉर 7 days में वी गो फॉर स्लैब, देन फॉर 5 to 6 weeks वी गो फॉर द कास्ट. नाउ स्लैब में क्या होता है, सी इफ देयर इज फ्रैक्चर ऑफ द फोरआर्म बोन, स्लैब इज POP will be applied only on this aspect and then you'll roll it over, and so this is slab. Okay, and the cast is you'll apply POP in the whole circumference of the limb, एंड इसमें इमोबिलाइजेशन ज्यादा होता है. बट इनिशियल 7 days में वी कैन नॉट गो फॉर कास्ट बिकॉज इनिशियल 7 days में देर इज अ लॉट ऑफ स्वेलिंग. सो आपने पूरा ही बंद कर दिया ना, सो द लिम्ब विल गेट स्वेल्ड, sorry, and there will be high chances of compartment syndrome, etc. Okay, so these are the different types of casts used in the lower limb. This is below knee cast, this is a below knee cast, below the knee, this is the above knee cast, and if it is till the greater trochanter it is called as the GT cast, and it is a above knee cast but you can see the ankle joint is spared, it is called as the cylindrical cast. शॉर्ट लेग कास्ट कहाँ कहाँ पे अप्लाई होता है, इट इज अप्लाइड फॉर फ्रैक्चर ऑफ द डिस्टल टिबिया और फिबुला और द फ्रैक्चर्स ऑफ द एंकल जॉइंट और द टार्सल बोन्स. But if the fracture is of the metatarsals and phalanges, here you give a special type of slab which is called as the chappal slab, in which these fingers are also not seen. It slab जो होता है वो यहाँ तक आ जाता है somewhere. The cylindrical slab, cast or slab is used for patella fracture and for fractures of middle or proximal leg, as well as for fracture of the knee joint and above the knee joint we go for the above knee cast or the GT cast. Okay, now for the upper limb, here you can see this is a below elbow cast or the short arm cast. This is the long arm cast called the above elbow cast, and this is a cylindrical cast in which, see, this wrist joint is free. So अगर distal end of the forearm bones का fracture है ना, so you can go for the below elbow cast. But if the fracture is of the proximal forearm bones or the humerus, you go for the above elbow cast. Okay, now what are the methods of treatment? What are the methods of treatment? Okay, so treatment of a particular fracture can fall in various categories. So first of all, functional use of the limb आपको करना चाहिए. के साथ भी you can treat the fracture like rib fracture or clavicle fracture है ना, or scapular fracture. You don't need any cast or POP or etc. और surgeries भी बहुत कम चाहिए होती है. You just need the patient to take analgesics, proper calcium supplement, take proper rest, immobilize the part, and the fracture will heal. Okay, so ribs may you do nothing. For scapula, you can just give patient a pouch arm so that यहाँ पे immobilization रहे. And for by immobilization alone, it can be for like surgical neck of the humerus, just give a slab. Okay, you don't need anything else if there is no displacement. Okay, now we have done most of the fractures are treated first by the closed reduction and followed by immobilization with a slab or a cast है ना. We have discussed it पहले. Then if it is unstable and there are chances कि it will get displaced, you can fix the closed reduced bone by percutaneous K wires. Okay, and if it is unstable or it is intra-articular or if it is compound, you have to go for the open reduction and internal fixation. See, this is a supracondylar humerus fracture in which it was first reduced by closed reduction and then it was fixed by percutaneous K wires, as you can see in the X-ray. So this is CRIF, closed reduction and internal fixation. Okay, this is also CRIF, but you will say कि सर इसमें तो nail डाली है तो ये तो open reduction होना चाहिए. No, open reduction is where you open the fracture site. यहाँ पे fracture site open नहीं करते हैं. यहाँ पे एक entry point बनाते हैं. You make a entry point, you insert the nail है ना, and you hold the fractured segment in alignment. You insert the nail, then you fix the nail by putting screws at the distal and the proximal end. So this is also a type of CRIF, and this is a intermedullary nailing of tibia. Okay, now this is, or if here you can see it is fracture of proximal tibia. So you incise the skin, you dissect the fascia, you separate the muscles, you reach the fracture site, you reduce the fracture segment, and then you fix it by inserting implants. Here you can see two plates and various screws are there to fix it. It helps in early mobilization, but there are more chances of infection and post-operative complications in this. Okay, so this is ORIF. See, and other is external fixators जो लगाते हैं. Basically it's most commonly use होते हैं for open and compound wounds, because उसमें अंदर you cannot do internal fixation by plates and nail also. Why? Because it is open, there are high chances of infection, and mind you, if orthopedic implant gets infected, any plate or nail or screw gets infected, जब तक वो आप वापस बाहर नहीं निकालोगे, the infection will not subside. Okay, the infection will not subside. Okay, Sorry guys, I am having a urgent call. Just 1 minute. सर मैं ओटी में था सर, बोलिए। हाँ सर, बहुत शुरू लगा था सर, बोलिए। हाँ हाँ सर, बोलिए क्या हुआ। ठीक है सर। ठीक है सर। ठीक है सर। ठीक है सर। ठीक है सर, मैं देखूंगा। हाँ हाँ सर। ठीक है। ठीक है सर। ओके सर। ओके। ठीक है। ठीक है सर, मैं देखूंगा। ठीक है। ठीक है सर, मैं देखूंगा। हाँ 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 सर। हाँ सर। हाँ हाँ हाँ। हाँ हाँ सर। ओके। 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 Sorry guys, there was an urgent call. So see, this is life of a doctor, and I think after passing your this PG examination, na, you will love this also. You are extra super busy and you are doing what you like. Okay, so where were we? Okay, we were on the external fixators and we were saying कि open wound में external fixators generally use करते हैं, and why don't we go for nailing or plating अभी से ही, because infection हो सकता है, and if any orthopedic implant gets infected you have to remove it and it's very hard to treat. Okay, so this is external fixator and you can see kaise externally you put the pins in the bone, you put a assembly here and you align the reduced fractured segments. Okay, so this is your external fixator. Okay. Now, there is a new recent advance which is called as MIS, minimal invasive surgery, or it is also called as MIPO. MIPO is minimal invasive procedure in orthopedics. Okay, and नाम से पता चल रहा है इसमें क्या होगा. Generally if there is fracture, if there is leg C, yeah, in this, if there is it is not it can be MIPO also. Okay, we don't, I am not able to appreciate by the x-ray. So नॉर्मल सर्जरीज में क्या होता है, इतनी लंबी प्लेट लगानी है, सो यू गिव अ इंसिजन फ्रॉम हियर टू हियर एंड यू open the fracture site, है ना, and then insert the implant. But if it is MIPONA, you will just put two small incisions here, you insert the plate here, है ना, then you'll align the fracture segments, or you reduce the fracture segments by proper instrumentation, and then you'll fix it by the screw. तो अब आप पूछोगे कि यार सर ये तो बिल्कुल ऐसे तीर हवा में तीर लगाने जैसा हो गया. नो, फॉर मिपो यू नीड सियाम और इमेज इंटेंसिफायर, IITV. Okay, it is a portable machine. Every good orthopedic facility have it nowadays, and in which what you get, you can shoot and you can see the x-ray imaging here and there only, है ना. So उसको use करके you get the reduction and you put the plate. Okay, so this is minimal invasive surgery and it is very common sense वाली बात कि इसके advantages क्या होंगे. Advantages होंगे कि healing will be much more faster and more predictable. क्यों? it will be more faster and predictable because incision कम है तो there will be less chances of infection, plus there will be less trauma or injury to the blood vessels and the soft tissues there, so it will help in early bone healing. Okay, so I have told you all of this. See, the MIS has the advantage that the blood supply of the bone is preserved and early union occurs. है ना? Less pain, early recovery, and cosmetically also it is advantageous. Okay. Now, reduction of fractures. Indications: not all fractures require reduction. ये भी important है. Like generally in children, proper reduction generally is not required if it is a diphyseal injury or if it is a green stick injury. But if it is intra-articular or an epiphyseal injury, perfect reduction is required. Okay, now like clavicle में you don't require reduction at all. You can just give a figure of 8 clavicle brace, है ना? And if it is not united in a properly reduced or normal anatomical position also, it will do, because कोई भी functional impairment नहीं होगा. There will be only cosmetic problem. Okay, so for example, a child's clavicle fracture does not need reduction because normal function and appearance will be restored without any intervention. Okay, but if it is intra-articular fracture now, as we have discussed just now, you need a perfect reduction. And now, what are the methods of reduction? We have already discussed. First and foremost is the closed manipulation or closed reduction, and it is usually done in the CIAM, which is also used in the MISC. This is your portable X-ray machine called CIAM machine or image intensifier. Here, ये क्या पहन रखा है? Lead aprons. Okay, we wear lead aprons almost regularly in our OTs to give a small जितना भी protection हो सके from the X-rays. Okay, this is the lead apron. Okay, this is the CIAM or the image intensifier. ना, these all are movable parts. You can move the parts according to the side and the angle of the image that you need, and see in this monitor you can get the real-time image. Okay, so it is very important, and this has changed orthopedics. Okay, this has really changed orthopedics, and that too in for the good of the patient, not for the good of the doctors. Doctors are getting X-ray shots. Like um, I have OTs 5 days out of 7 days of a week, and I get like at least 100 shots of CIAM in that OTs. Although I wear lead apron and all, but still 100 shots of X-ray in every OT. And approximate बता रहा हूँ ये मैं. It is a lot. Okay. So yes, but for the patient, it is very good. So closed manipulation, mind you, closed manipulation सुनने में easy लगता है, but it is very difficult. First of all, for the doctor also, because you need traction and you need force. You need a large amount of force because bones को हिलाना is not easy, because there is so much muscle pull and so much soft tissue around the bones that it is not easy to manipulate the bones. And secondly, the patient is in so much pain already, and जरा सा touch करते ही the patient just shouts. Okay, and some patients I have even seen that they go into vasovagal shock and all. So it is advisable to you give a short GA, especially in the children, है ना, before attempting the closed manipulation. Okay, so an availability of image intensifier greatly added to the skills of close reduction. Okay, and almost mostly can be done by the close reduction, and it is then fixed or immobilized by use of POP or brace or bandaging. Okay, now secondly, there is another technique called continuous traction, and it is almost obsolete nowadays. Okay, it is almost obsolete nowadays. And continuous traction में क्या होता था, after reducing the fracture side, you give a continuous traction by different types of tractions used, like BK traction or Smith traction or Dunlop traction for the humerus, BK traction for the lower limb. ओके, सो कि जो रिडक्शन है वो उसी पोजीशन में मेंटेन रहे, बट देयर आर मेनी ड्रॉबैक्स ऑफ दिस. फर्स्ट, ला इंक्रीज अमाउंट ऑफ बेड रेस्ट एंड इमोबिलाइजेशन, जिससे बेड सोर्स एंड मसल वास्टिंग एंड आर्थराइटिक चेंजेस अराउंड द जॉइंट्स ये होते थे. सेकेंड, patient compliance is poor because you need this traction at least for around 1 month. So patient compliance is very poor. Okay, so there were, and also there were high chances of redisplacement. Okay, and commonly in IT fracture में continuous traction, BK traction, below knee traction से काम just a few years ago, like 10 to 20 years ago, it was the best mode of modality of treatment for IT femur, but not nowadays. Okay, see, so even in our practice also, a patient is admitted and it takes around 1 to 2 days before the surgery, because COVID report and all बहुत सारी problems होती है. So for the 1 or 2 days before the surgery, we keep the patient of IT femur on continuous traction for 1 or 2 days. Okay, see. So a continuous traction can counter this force. What is this force? This force is of the muscle and the soft tissue force, so that वापस रीडिस्प्लेसमेंट नहीं हो जाए. Okay, but the continuous traction has its own problem of keeping the patient in bed for long time with its complications like bed sores, and also there is high uncertainty of the result. Okay, so see, this is a BK traction. This is a BK traction. See, here you have attached the traction, you have tied it, and you have tied a big stone, or here it is water, but you can tie a stone also here with the help of the pulley and a thread. Okay, so there is continuous traction in this direction. So there is continuous traction in this direction. Okay, now ओपन रिडक्शन वी हैव डिस्कस्ड ऑलरेडी. ओपन रिडक्शन में क्या करना पड़ेगा? ओपन करना पड़ेगा. यू हैव टू सर्जिकली एक्सपोज द fracture site. You have to surgically expose the fracture site and then put the implant. It is called as ORIF, open reduction internal fixation. Okay, and the choice depends on the surgeon and the type of the fracture, the condition of the wound, the area at which that fracture has occurred, also the age of the patient, like 70 years female hair, the bone will be highly osteoporotic, so you go for closed reduction only, because open reduction karke you'll put so much screws in them, but the bone is already osteoporotic, so hold ही नहीं आएगा screws का, है ना, and it will lead to more weakening of the bone. So it depends on the variety of fracture. Okay, so one reason to do open reduction is when other methods of achieving reduction have failed, or the fractures are so unstable that they need to be fixed by surgical manipulation only. So what are the absolute indications of open reduction? The absolute indications are failure of closed reduction, if it is displaced intra-articular fracture, or it is epiphyseal type 3 and 4. And what are these type 3 and 4? It is according to which classification? We have discussed this so many times now. It is okay, I'll discuss it first thing in the next class. Okay, it is very important. Now or if there is major avulsion fracture like of the patella, or there is non-union. Okay, so this is, and what are the relative indications? If there is delayed union or malunion, or there is multiple fractures like segmental or comminuted fractures, or pathological fractures, or where close reduction is ineffective like neck or femur. Remember this, fracture neck or femur has to be managed surgically every time, because there are high chances of avascular necrosis. Okay, so you cannot do close reduction or cannot manage this fracture conservatively. And if there is fractures with vascular and neural injuries, then also you have to go for open reduction. Okay, now why a fracture needs to be immobilized, कि क्यों immobilize करके रखना पड़ता है? We have discussed it, we are just revising it. First, to prevent displacement or angulation. If will not immobilize, अगर displace नहीं भी हुआ तो displaced हो जाएगा और angulate हो जाएगा. And if there is greater angulation, the sharp edges can lead to soft tissue injuries and nerve and vessel injuries also. Okay, so it is very important to immobilize the patient. Okay, now एक और बात with which you need to remember is कि, see, if there is fracture now, and if there is like only this much of displacement, so it is acceptable and the bone will heal. But if there is angulation like this, है or if there is rotation like this, it is not acceptable, and you have to manipulate it either by closed or open reduction. Okay, and other reason for immobilization is to prevent movement that might interfere. Obviously बात है, हड्डी को sticky and to allow the callus to form, you need to immobilize the fracture segment. If it will continue to move like this, it will not get sticky. Okay, but strict immobilization is necessary for some fractures, and the most important of them is scaphoid fracture. And why do we need strict immobilization here? Because of, again, increased chances of AVN. Okay, and to relieve pain, and the most important reason for immobilization is to relieve pain. Okay, now what are the methods of immobilization? We have already discussed. Non-operative methods में there can be strapping, like fingers में fracture हुआ, so if there is a fracture here, you can just strap this two finger with a tape or micropore, है ना, and it will do. So it is strapping, or a sling, like we have already discussed, or cast immobilization that we have discussed also, Anna. And most common method of immobilization is cast, and there are two types of cast. First is the POP, plaster of Paris cast, and a new generation cast or नया cast आ गया, that is of fiber glass. And इसके क्या benefits है? First of all, it is light weighted. POP casts are very heavy weighted. Okay, light weighted, itching and skin irritation वाली problems जो होती है वो कम होती है. Okay, and they are more compliant for the patients. Okay, they are radiolucent and more durable. And in POP, what we use gypsum salt CaSO4. We use gypsum salt CaSO4. Okay, so just remember the images and the name. This is the Minerva cast for cervical spine injury. This is the research cast for scoliosis. Now what is kyphosis? What is scoliosis? Kyphosis mein there will be forward or backward bending like this. This is kyphosis. But in scoliosis, the spine will be like this. This is scoliosis. Okay, so this is research cast for scoliosis. This is Minerva cast for spine, cervical spine. And this is a turnbuckle cast again for scoliosis. Okay, this is shoulder spica for the shoulder injury or shoulder joint fracture. Similarly, you have hip spica also. And this is U slab for the fracture of humerus, also called as sugar tongue slab. From the nape of the neck, you run towards the lateral aspect of the arm. You then go around the elbow joint and you go to the medial side until here, and then you tie a sling with 90°. This is your U slab. And laterally kyun? Because most common position of angulation of humerus fracture is lateral angulation. Okay, hanging cast again for fracture shaft humerus, and that too किसमें? Distal humerus fracture में. Okay, distal humerus fracture में. Pulleys cast we know below elbow होता है till the head of metacarpals in palmar flexion and ulnar deviation. And similarly palmar flexion and radial deviation में भी एक cast लगता है, that is scaphoid cast. Okay, but एक और difference होता है, here the thumb is free. You can see here in Cooley's cast the thumb is free, but in the scaphoid cast you get the POP till here. Okay, so it is, this is hip spica as I was telling you earlier, okay, for the fracture of hip or the femur, especially in children. And we make a window here. Okay, this is a window. We make a window here, and the spicas of cast कोई open wound में भी करते हैं. See, if there is a wound open here and I want to treat it by a cast, so यहाँ पे जो wound है यहाँ पे I will make a window for the dressing. Okay, so windows can also be made. This is a cylindrical cast we have discussed in the image earlier, or it is also called as tube cast for fracture patella. Okay, for fracture patella. Now this is a PTB cast for tibia fracture. What is PTB? PTB is patellar टेंडन ब्रेस कास्ट. एंड इसका क्या यूज होता है, क्या एडवांटेज होता है? द एडवांटेज इज दैट द नी जॉइंट मोबिलिटी can be done by this cast. See, if there is fracture of tibia na, and you are managing it conservatively, for 7 days you go for a GT slab. ठीक है, then for around 3 to 4 weeks you go for the GT cast, and after that for 1 to 2 weeks you go for this PTB cast, so that the patient can start the weight bearing as well as can start the movements at the knee joint. Okay, now how to make a sling? So this is how you make a sling. You can take any cloth, Anna. You just need to round it around the neck, and you just need to, this is the slab 90° एंगल पे. ठीक है, एक knot आप पहले से ही बांध लो, and then when this knot comes here you tie a knot from the behind, and then you can tie it according to the position of your choice, या जैसे भी आपको comfortable feel हो. This is a sling. Okay, but nowadays better slings like this is called shoulder immobilizer pouch arm, so you can use this sling, easily available in the market, more compliant for the patient. Okay, this is sling. Now types of plaster bandages. There are two types of plaster bandages. First, homemade, in which normal bandage is there of cotton, and you sprinkle POP powder over it, and then you make it wet, and then you roll over. ठीक है, so chalo, I'll teach you how to put a slab or a cast. First of all, reduce. After holding the reduction, first of all you put a cotton bandage around it, a roll of the cotton around it, and it should be proper. Otherwise, cast will be too tight and very uncomfortable for the patient. So cotton bandage अच्छे से लगाओ. Then if it is slab, you put a POP, wet POP bandage, either homemade or commercially made भी आने लगे आजकल here. Okay, and if it is cast, you roll the POP bandage after making it wet here, and after that you fix that by a wet bandage. Okay, so now I've already discussed what is the difference between slab and cast. Okay, slab only a part of the circumference of the limb. Okay, and what is cast, whole of the circumference of the limb. And slab या cast लगाते time you have to keep in mind few things. First of all, if for example यहाँ पे fracture है, so fracture line से ऊपर, above and below the fracture line you के एक एक joint you need to immobilize. So that's why अगर यहाँ पे fracture है, so we give the slab or cast till here to here. Two joints are immobilized. Okay, first of all. Second, they should be put in functional position. ऐसे नहीं कि है ना, they are put here and they are put in functional position. ऐसे नहीं कि arm is in semi pronated or mid pronation and you have applied the slab. No, and you have to adequately pad the limb, especially on the bony prominences, as I have told you earlier. Okay, now after care of a plaster, first of all, there should not be any cracks and plaster should not get wet because POP है ना, plaster POP है, and if it get wet it will break. Okay, and you have to start the weight bearing as scheduled and taught by your doctor. And inside slab or cast also you need to exercise your muscles. Like if it is cast is above elbow from here to here, actively movements of the finger, we tell the patient to buy that smiley ball and move the fingers the whole day and move the shoulder joint. Okay, it is very important, otherwise all will get stiff, and that will be a bigger problem. Okay, now complications of the plaster treatment, the most important and most common is the tight cast, which will lead to impairment of the circulation, compartment syndrome, it will form a closed compartment, है ना, and जो hematoma बना है and tissue edema हुआ है, it will put pressure and compress the vessels as well as nerves. Okay, so how would you suspect it? First of all, there will be increased swelling. There will be pain out of proportion of the pain of any fracture. There can be gangrenous changes, there can be tingling sensations or loss of movement of the fingers, or there can be bluish discoloration or hypoesthesia, etc. So to avoid tight cast, first of all, adequate padding is extremely important and you should keep the limb elevated. Now what are plaster sores? नाम से पता चल रहा है, if there is inadequate padding or irregularity of the inner surface of the cast or if there is any foreign body in the cast, so plaster sores हो जाएंगे ulcer like. So इसके clinical features क्या होंगे? Same, pain out of proportion, disturbed sleep due to the pain, recurrence of the swelling, or there can be fever also, or there can be bloody patch or patch of a soakage here. Okay, and if plaster sore is formed, you form a window over the cast and you do a regular dressing. Okay, now another thing that you should know is functional bracing. Now what is functional bracing? Functional bracings are plastic or cloth के equipments like this you can see, and they are put after the cast where the above and the below वाले जो joints होते हैं they are not immobilized, है ना. Here only the affected part is immobilized and the joints are free for the movement. Okay, so they are for generally for the rehabilitation to make the uh, um, sticky, already sticky and the callus formed fractured part more supportive, है ना. So इसके लिए होता है functional bracing. Long knee brace is generally used for knee injuries and for that tendon injuries, ligaments injuries जो होती है knee में, which are very common like ACL, PCL and meniscus injuries which we will discuss. Okay, so उसमें we go for the long knee brace. ठीक है, it is used for stable fractures, okay, of tibia and humerus mainly. Okay, and the basic principle is that of continuous use of the affected limb while the fracture is kept adequately supported. Okay, and the most important thing ki brace is applied after the fracture becomes sticky. Okay, now splints and tractions, we have discussed what is splint and what is traction. Most commonly used splints nowadays also is the Thomas splint for fracture shaft of femur. Okay, so Thomas splint में क्या होता है, see यहाँ पे ये थॉमस स्प्लिंट का ये गोल गोल वाला पार्ट आ जाता है and here is the cage in which, and here you also attach the BK traction. So this is Thomas splint for fracture femur, especially shaft of femur, and more newly introduced thing in the market is the inflatable splint, as you can see here. Okay, so Thomas splint is very popular for treatment of fractures of the lower limb, and disadvantages we have already read: prolonged hospitalization and confinement to the bed and non-compliance of the patient, and especially in elderly people it can be hazardous because bed sores, chest infection and all के chances बहुत ज़्यादा बढ़ जाते हैं. See, this is head halter sling for again cervical spine injury. Okay, see, this is a splint for finger splint. You can splint by bandaging also, or this is a commercial splint. This is a cock-up splint, and you can use this for fracture of your metacarpals or phalanges as well as for radial nerve palsy. This is turnbuckle or Volkmann's splint for Volkmann ischemic contracture. Okay, these are various types of splints. Now we'll come to the operative methods. In operative methods, we have already discussed external fixation. We have already discussed कि कब होगा, open wounds में होगा, और you don't want to open the fracture site, but still you need surgical fixation because displacement is very much, or internal fixation where it is very unstable, है ना, or it is intra-articular or closed, has failed, or vessels and nerves injuries or epiphyseal injury is there. Okay, you go for the internal fixation by various things which we have already discussed. Now, what are the indications of internal fixation when the fracture is stable? Okay, it is the most common indication. Okay, and if we need early mobilization of the patient, okay, and if there is neurovascular injury associated, and how can we internally fix the bone by steel wire or K wire or the Kirshner's wire, okay, or intramedullary nail like we have seen in the photo, or by screws alone or plate and screw, or by specific implants for specific fractures. Okay, like we have specific plates for specific body parts, we have specific screws, है ना. So or if there is neck of femur fracture in elderly, we go for bipolar hemiarthroplasty. Okay, and a combination of various implants is used generally. For patella, we go for the tension band wiring. This is K nail, not K wire. This is K nail, Kushner's nail for fracture shaft of femur. As you can see, not K wire, it is K nail. Okay, this is Smith Peterson nail, again used for fracture femur. Okay, and this is DHS dynamic hip screw. Now, joint mobilization. I have been in for 1 year in orthopedics, and मैंने सबसे इम्पोर्टेंट चीज जो सीखी यहाँ पे वो सीखी है कि the operation or the reduction is only 50% part or 60% part, but most important part, no doubt, but it is only half a job done. Okay, but to attain the full functional movement of the joint and pre-injury level जैसे movements के लिए you need joint immobilization, physiotherapy and exercise at the right time, in right proportion and of the right order. Okay, so the bone and the joint tends to get stiff due to immobilization, inability to move it due to pain, and if there is associated injury of the joint or there is intra-articular fracture. Okay, so you need to mobilize it as soon as possible. So if there is the patient is in cast or slab, so passive mobilization you need to do, like अगर वो खुद फिंगर्स नहीं चला पा रहा है, so passively the attender should move the fingers. Okay, so passive immobilization is very important, and when the pain subsides है ना, then the active mobilization by the patient is very important, and इन दोनों के बीच में active assisted, and it is very important in like head injuries patient, like there is some hematoma in the head due to an accident, as well as there is fracture of any bone, so the patient will be either unconscious or disoriented. So like for 15 to 20 days at least वो जो पार्ट उसका, जो जॉइंट उसका स्लैब या कास्ट में नहीं है, that part also he'll be not be able to move. So for that, passive mobilization is very important, and nowadays there are motorized devices also which mobilize the concerned parts in a predetermined range, and these are called as CPM, continuous passive motion machines. Okay, and other techniques are hot fomentation or gentle massage, etc. Okay, and what are muscle re-education exercises, यानी muscles को पहले चलना आता था, but now इतने time तक they are immobilized that there is wasting atrophy, so we have to re-educate the muscles. Okay, this, and this can be done even during the immobilization. How? By static contraction or by dynamic contractions. Now what is static contraction? Static contractions are immobilized. If the patient is immobilized, then you do the exercises of the muscles, it is static contraction, and after removing the cast, slab or external immobilization, you contract the muscles, it is dynamic contractions. So static contractions कैसे करते हैं? Static contractions, the joints which are out of the plaster, they should be moved either passively or actively. Okay, and the muscles working on the joints inside the plasters cannot be contracted without moving the joint, so this maintains some functions of the immobilized muscles. Okay, pretty well self-explanating. Then after removing the mobilization, then you can move the joint freely, but weight bearing and kitta weight and how to bear the weight and what exercises are to do and in which range of motion, these are all very important, and all this should be done in a proper supervised care. Okay, now functional use of the rib. Once a fracture is on the way to union, okay, you need to start the physiotherapy so that the functional use of the limb like that of the pre-injury level can be done. There should be gradual weight bearing in the lower limb, first partial using a walker or a stick, then complete. Okay, and all this is supported by brace and caliber or cast like PTB cast we have discussed, etc. Okay, so if there is any fracture, wait, yes, if there is any fracture, सबसे पहले vessels and nerves check करनी है, and if they are okay and if the fracture is undisplaced, you can go for the conservative management followed by physiotherapy. If it is displaced, first you need to go for the close reduction and manipulation, and if it is acceptable, immobilize and physiotherapy. If it is unacceptable, you can go for open reduction, and if it is displaced पहले से ही or intraarticular or open or compound, you have to go for the surgery straight and away. Okay, now management of the open fractures, I think we have discussed almost all of it, and it is also called as compound fractures, and there are three basic consequences. First, infection, and infection can cause non-union, failure of the implant, and soft tissue injury, gangrene, wasting of the muscles, as well as necrosis of the bone. Okay, and it could go into osteomyelitis after treatment. So infection of the bone is a very fair possibility, and inability to use traditional methods like simple cast and brace, because इतने time तक if brace के अंदर you will put a open thing or compound fracture ना, there are high chances of infection. So you can make a window as we have discussed earlier. So non-union and malunion are very common in open fractures, because in open fracture there can be bone loss, there can be infection which will lead to non-union, the fracture hematoma which helps in the healing, and that have the osteogenic potential is lost. Also the vascular coverage is lost because of the injury to the soft tissues, and secondary infections तो हो ही सकता है. So the treatment, किसी भी open fracture का treatment, first of all you have to give the tetanus. You have to wash the wound very meticulously in the casualty only. Then if the closure is possible, you have to close it by the sutures, then put the slab, and then shift the patient to the ward and start the antibiotics. Then you have to take care of the wound of the patient, and when the wound is clean, you can go for the surgery. This is how an open fracture is treated or managed. Okay, so, and there is a very important classification for the management of open fractures. You have to basically just remember the name. It is important, the name is important, and it is modified Gustillo and Anderson classification. Modified Gustillo and Anderson classification. Type 1, 2 and 3. Type 1 में less than 1 centimeter but clean and simple fracture pattern will be there. Type 2 में there will be more than 1 centimeter with soft tissue damage and infected dirty wound, but it is not extensive and no vessel or nerve injury, and the fracture pattern is also simple, no combination or segmental. And इसके अलावा जो भी होगा there will be three. Third, 3A, B and C, as you can see in the diagram. 3A will be bone exposing dirty wounds or multiple segmental or comminuted fracture, but in 3B the bone will be exposed to the environment with displacement, and in 3C there will be neurological or vascular injury also. So as we have discussed in emergencies department, first of all you have to do the wound care as I have mentioned earlier, wash it, and then you have to close it if possible, then splinting, then prophylactic antibiotics, tetanus, analgesics and x-rays. You often need help of plastic surgeons. So if it is the, what is the protocol? The protocol is, if there is extensive open fracture, now first we wash the patient, shift the patient to the ward, we plan surgery, and we again wash and debride the wound and put the external fixator, we fix the bone, and then we shift the patient to the plastic surgery, and there the wound management is done. And when the wound is clean, they do when the wound is clean, they do the grafting or flap, so that the skin condition, फिर जब skin वापस आ जाती है, grafting and flap हो जाता है, we remove the fixator, and then we go for a definitive surgery for the bone that is orange. Because generally if there is infection so much extensively open या compound injury होगी, so the bones will not unite, and external fixator is not always a definitive thing. Okay, so then we have to go for the orange. So this is the definitive care. Many surgeries are required by the patient for orthopedics, for plastic surgery. Okay, and it is a long procedure. Okay, now wound care, wound debridement कैसे करते हैं? Wound debridement में first of all you open the wound, you incise and cut all the necrosed margins of the wound. Okay, then you wash it by NS, betadine, and in some settings H2O2 is also used, hydrogen peroxide. Then you wash the patient wound, you close the wound by sutures, only simple sutures, skin sutures are applied. And if the wound is closed, then you give the antibiotics, put the patient in slab and cast, and when the wound is clean, you go for the orthopedic surgery. And if the closure is not possible and the wound is very extensive, you shift the patient to plastic surgery after applying a fixator, just so that जितना भी reduction हो सके bone का possible वो करके, then the plastic surgeon does the flapping or grafting, and after the wound is totally healed, the patient again comes to the orthopedic team and the surgery, definitive surgery is done. Now during debridement, अगर आपको necrosed muscle, we remove necrosed muscle, necrosed tendon, or in fact necrosed bone, जो भी necrosed या highly infected part है, you just have to remove it, because नहीं तो वो reinfection करेगा. Okay, so this. Now definitive wound management is done by plastic surgery, we have seen that. And fracture management we have already done. So कोई भी open wound होगा, so here is the line of treatment. And a small puncture wound है, just debride it, wash it, and leave it as it is. And जब the condition is good, just go for the POP, slab, cast, or any surgical intervention. If it is clean lacerated, you can do the same. And if it is doubtful lacerated, okay, observe with antibiotics. And if it is no infection, you can go for the orthopedic intervention. If it is infection, again debride it and wait. And if it is infected and extensive wound, you have to first let it heal by secondary intention, or you have to go for the plastic surgery. Okay, now skeletal tractions we have already discussed. Okay, so and phase of rehabilitation we have discussed that physiotherapy कितनी important है. So all this was about the management of fracture. I hope you have understood it. I'm planning a special class on very important topic on bone tumors. At least 200 में से 1 to 2 question definitely you will get at special class. So just download the app and subscribe, both of which are free. Okay, then you can see my special class. You can use this code to get extra 10% off in case you are planning to buy any paid subscription plans. Okay, so thanks for watching the video. I hope you liked it. Please like, share and subscribe. Okay. uh, and use this code for buying any subscription plan. I hope you like the video. Okay, so bye bye. Stay focused, study hard, eat healthy, sleep, and just revise and do lots of questions. Okay, all the best to everybody.